dementia, we particularly insisted something about 4 A's, right? A, 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 A. A for amnesia. A for aphasia. A for Apraxia. A for Agnosia. So how to remember this? A for amnesia, completely to deal with memory. Right? A for agnosia, completely to deal with senses. Right? Then A for apraxia, completely to deal with water. Then A for aphasia, completely to deal with communication. Or inside that, we need to understand the cognition also. The cognitive level of understanding the things. Okay? What is amnesia? It means how far we can remember, short-term memory or long-term memory. Both the things, right? Both the things, short-term memory, what you have eaten in the morning, what you had for the breakfast. Sir, I ate 2 idlis. Fine? That means it is not affected. And last year, for your birthday, what do you remember what you did for last year's birthday? Yes, sir, I went to a temple or something. That means you remember the previous one. That one is past, and this one is at present. This is short-term memory and long-term memory. According to Sigmund Freud, right? What he is saying, the memory can be divided into 3. One is, anyone remember? The memory which is at the level of conscious levels. Then, anybody? First year, psychology. At the level of consciousness, then at the level of unconsciousness, then at the level of subconsciousness. He compares that memory with the iceberg, right? So, conscious memory, that means the short-term memory. Then, subconscious memory, unconscious memory. That means what we have forgotten, right? Something we don't know, we forgot. Then subconscious memory, we know that we think a little and we come to that. For example, the same example, what you had for the morning. Morning, I had a cup of coffee. Last year birthday, what did you do? So I went to temple and we cut cake and we celebrated inside the home. What you did at the age of 2, you were playing with the ground and you fell down. Do you remember? I don't know. You don't remember. But actually speaking, you remember. But that is very deeply present in your brain and all the other memories which came out of that and it is hiding now. Right? So actually you know, but it is not coming out. It is immersed inside you. That's called subconscious. It is hidden there. So in that way, we can classify memory into 3. So these kind of memories can be any kind of memory. These kind of memories can be affected. So in that way, we can call it as amnesia. Particularly the unconscious one, or particularly the short-term one, or particularly the subconscious one, we can call it as selective amnesia. Right? For example, I study a lot, sir, but I cannot remember. Only education purpose, all these things are I'm forgetting, sir. Selective memory. Because we don't like that, so we are forgetting it purposefully. Selective memory. Right? So I'm watching all the movies. I can sing hundreds of songs perfectly, sir, but I'm not able to read one thing and I'm not able to repeat it in the exam, sir. Selective memory. Simple reason. I don't like it. That's all. Right? Songs, I like it. And this one, I don't like it. That's the thing. Okay? Understood? Okay. Then Aphasia. What is aphasia? Communication. Communication. For example, somebody is speaking to you. What is your name? Where are you going? Sir, I'm going here. My name is this. We are able to communicate perfectly. We know what is that person, what he is asking. We can able to analyze that, understand that, and we know how to reciprocate for that. The problem may be from the cognition, or the problem may be in the oral region. So if you are not able to produce any movement or something, that is coming under this one. But we are completely speaking about the communication level. What is asking, what we are understanding, what we are perceiving, what we have to actually reciprocate. That kind of thing is called aphasia. I mean, when that kind of things are affected, that is called aphasia. Then apraxia. Apraxia is completely motor. Apraxia, in that same example, I know what you are asking. I know what is the answer. I know how to reproduce it, reciprocate it, but I'm not able to move my jaw or oral regions and buccal regions. I'm not able to reproduce it perfectly by means of some motor deficient. That is called apraxia. In other words, the patient is not able to do any kind of jobs. If you're giving a task, go to the grocery shop and they can buy some tomatoes or something. He is not able to do that. He cannot be able to do that perfectly. Okay? Cognitively, that is affected. He cannot remember that. He cannot properly go to the shop. He cannot properly communicate with the fellow, and he cannot take it out, and he cannot get it to the board. So that is apraxia. He cannot complete the task particularly. Right? Then agnosia. It is all completely about sensory. From the same example, you are speaking something, I'm analyzing. I cannot interpret properly because of the sensation of hearing is affected. There is not deafness. I cannot properly interpret it. What you are speaking, okay, what you are saying, what is the word, what is the meaning of this word? I cannot remember. I cannot understand. Or else, purely, I avoid this example and go to some other example. Okay, for example, the best example will be they know what is urination. But the point is, they cannot interpret when they are feeling urination, no? When they feel a tightness or heaviness in the lower abdomen, they can't understand that, and they cannot go to the restroom, and they cannot go to pain. Okay, they know, and even though they cannot able to communicate it also, I feel tired, I feel urination. Can you help me like that? They cannot say, but they will feel bladder filling. They will feel that, but they will not say or they will not interpret it. Okay, we have to go for pain or something. They cannot explain it. Okay, that's the important strategy about this agnosia, because the sensory interpretations will be affected. Okay, when sensory interpretation is affected, that is agnosia. When the motor interpretation is affected, that is apraxia. When the communication or cognitive interpretation is affected, that is aphasia. When purely the memory is affected, that is amnesia. These are the four classical cases of dementia, classical signs of dementia.